Okay, so thank you everybody for being here. So my name is Lauren. I'm the program director for this acute care residency here at Stanford. I'm gonna have the other people in the room introduce themselves and then we'll get started.
Hi, my name is Michael Toronto. I'm the acute care physical therapist here at Stanford. Very proud to be the first one here. I'm hoping to inspire you all to want to join and keep the strong tradition alive.
He's our first resident. You guys can hear him? Yeah, okay, good. All right.
And I'm Christina. I'm a physical therapist here, primarily on oncology, but I did an acute care residency at another program, actually with Lauren. And so, yeah, I like intermittently help out.
Yes. And Christina will be primary mentor on medicine,
Yes.
plus or minus, maybe
Yeah.
some other services too. Okay, so like I mentioned earlier, I'm going to go through some slides here, kind of give you, an overview of our program a little bit more in depth than maybe what you see online, or maybe hopefully answer some questions that you have regarding our application and admissions process. And then there's going to be time at the end for you guys to ask questions about anything regarding the program or anything that you feel wasn't covered or that you couldn't find elsewhere online. So here's kind of what I hope you will get out of this short presentation. We're going to go over the mission so you can see kind of like why we really wanted to have this program be established and what it stands for. We'll talk about the admission requirements, what kind of an overview of what your year will look like during your time as a resident. We'll talk about a little more granular than that. What does the sample weekly schedule look like? And then go over kind of what you need to know in terms of applying, interviews, and then hopefully getting an offer if you decide that you want to be a part of our program. Okay, so I included this picture in the presentation because it just really illustrates the breadth and depth of, the Stanford Healthcare Network and kind of the really great impact that Stanford has all over the Bay Area. So not only is Stanford comprised of the primary medical center, which you will be having your residency here at the main campus in Palo Alto, but there are also many satellite clinics, outpatient clinics. There's Tri-Valley in the East Bay, I want to say, maybe. Yeah, everybody's saying yes. And then, of course, just other various partnerships. For example, Stanford is currently leasing a unit down at Sequoia Hospital in Redwood City. So there's just a lot of growth and expansion happening all the time. And it's just a really great place to be if you choose to start your career here. So a couple other quick facts. So like I mentioned, this program will be in Palo Alto, California through the primary hospital here. It's only the adult acute care population. So we do not have rotations with pediatric populations. And there currently is no rotation down at Sequoia Hospital right now in Redwood City. So it's only here in Palo Alto. Stanford is considered an academic medical center, so it's highly dynamic. Oh no, it says something is wrong on my screen. Can you guys still hear me? Can you guys hear me now? Sorry, my computer is like going crazy. This happened last year too. This must be like, I don't know what it is, but anyways, okay, we're back. We're back and we have power. Okay, sorry about that. That was so weird. Okay, so Stanford's an academic medical center. It's a teaching hospital. So what that means is when you're a resident here, you're going to be interacting with so many different people who are involved in the interprofessional medical team. So there's a lot of, post-professional learners, people who are completing their residencies in medicine, in other specialty areas. There's fellowship programs. So there's always a lot going on at all times, and that just makes for a really impactful and dynamic learning environment. Stanford Hospital is also considered a level 1 trauma center. So that is something that I think makes this program really unique. Outside of maybe other acute care residency programs, you really get to experience kind of what that acute trauma population is like. We have a world-renowned comprehensive cancer center. Also, I think is something that sets us apart from other acute care residency programs, just really innovative and a lot of really cool clinical trials and things that are happening with the cancer population. This is also a transplant hub for the region of Northern California. And a lot of people actually travel to Stanford specifically to get solid organ transplants from all over the world. And then Stanford also has a very well-renowned orthopedic physical therapy residency program in outpatient. They've been around, I think, over a decade now. So, lots of really great opportunities to learn and grow. Okay, next. Okay, so this is our mission of our program. You guys can obviously read it at any time, or you can go through it and read it on your own. But basically, we are here to really drive this dynamic program to create really dynamic, high-performing, advanced clinicians in acute care PT. And I think all of us can attest to this, but definitely Christina and myself, who graduated from a different acute care PT program, these programs are designed to really make you feel that you can do anything once you graduate in acute care. You really feel like you are highly skilled, competent, and really able to manage, be a really proficient clinician in acute care. So that is essentially what we are describing in our mission. We're creating a program where, we can help support that and help develop really dynamic providers in acute care. Okay, so here is what is required for you to be considered for admission to the program. So you have to be a graduate of an accredited PT program. You have to be currently licensed in the state of California. Or you can also be a licensed applicant who has passed the California licensure examination. So there might be a, I guess, caveat to people who have PTLA status, but typically in order for you to come in as a resident, you have to be licensed in the state of California. So you have to pass your boards before you start in August. You have to be a current member of the APTA and the Academy of Acute Care Physical Therapy as a requirement. And that is because, one, typically if you're a newer grad and you are still having these memberships, one, I know the Academy of Acute Care PT gives a free membership to residents, right? And then if you're a new grad, APTA memberships usually are at a discounted rate right out of graduation for the first 5 years. But this also just gives you really great like networking opportunities. And, we also interact with APTA and the Academy of Acute Care really closely for other, courses and things that we want you to participate in. So that is a requirement as well. You must complete an online application through RFPTCAS. So this is different than what we did last year. So, and I'll talk about the RFPTCAS component in a little bit. You must also complete an employment application with Stanford, and I will also touch on this a little bit later. Once you complete all of the written application components through RFPTCAS and then through Stanford Careers, then you will have a phone screening, which is done by me. So we'll have a conversation kind of about your goals and, if you're still interested in pursuing this program with us. And then we will, if everything goes well with the phone screening, then we will progress to perform an interview with the residency interview committee. And then if all goes well, then you will receive an offer of acceptance into the program. Okay, so this is kind of small, so I don't know, you guys might have to kind of zoom in later. but this is an overview of basically what an entire year of the program would look like. This is actually taken from this current year, 2024-2025, which is the year that Michael is currently in. And so you can see that the term spans from August to August. So the next cohort for 2025-2026 will start in August 2025, and then will end in August 2026. On the left-hand side, you can see that the whole year is broken up into 3 what we call trimesters. So you see on the left, there's pink and purple and blue. So the pink trimester, the first trimester that you rotate in, you start on ortho and trauma, and then you rotate now down to cardiopulm. And then the second trimester starts with neuro, followed by oncology. Then the third trimester, you're doing more onc med, ED, CDU, medicine, general medicine, and then you end with transplant and then potentially an option for a rotation in the ICU at the end. So that's kind of like an overview of the year. What you can see as you go down the line, kind of that diagonal line of boxes that you see in the middle of the screen, that is showing you the length of each rotation. And each rotation is actually a different length by design. So the longest rotations are cardiopulm and neuro. They're about 10 weeks apiece, whereas the shortest rotation will be about a month, which is that last rotation at the end of the year, which either can be ICU or an elective experience, or potentially maybe you're rotating back to a different service because you either want or need more experience in a certain area. And then each trimester is separated by the examinations. So you can see the green boxes that are kind of spread between the trimesters. That indicates about around the time when you would have an exam. And the exams are both a written exam, well, it's online, but a written exam, and then a live patient exam. And you'll have 3 of them over the course of the year. Okay. So then if we get even more granular than that, this would be a typical kind of an example of what a potential week would look like for you. So our residents operate on a Monday through Friday schedule. It's full time and it's 40 hours a week. And it's 8-hour shifts. So what you'll find when you start working in Stanford, a lot of our therapists work on different time schedules. So some work on 8-hour shifts, some work 10-hour shifts, and then some even do partial shifts like 6 hours or even 5 hours. So for residents, it's just a standard 8-hour day, plus or minus starting around 8 in the morning and then ending around 5 o'clock. The green boxes are all denoting kind of chunks of time where you're going to be involved in patient care. So that is when you have a list of patients that you're responsible for and you're managing that caseload. And you can see in the parentheses under patient care on the left, these are the target hours that you have to meet for accreditation standards for the program in order to graduate. So throughout the whole year, you have to achieve 1,500 hours of patient care for the whole year. And that is inclusive of that blue box mentoring, which is 150 hours for the year. So I think I think all of us can attest to this in this room, but one of, I think, the biggest characteristics that draw people to a residency program is the one-to-one mentoring that you get in a residency program, because it is unlike anything you will ever experience in your career. I think, unfortunately, when you go out into the workforce, and no matter what setting you choose to work in, outpatient, inpatient, whatever, unfortunately, I think a lot of organizations wish that they were giving more structured mentoring to their employees or during cross training or whatever the case may be. And unfortunately, it just doesn't always happen for a whole myriad of reasons. This mentoring time is protected time that you get every single week with a primary mentor that's assigned for each rotation. So it is designed to really help you, dive deeply into clinical cases, really, hone in on your clinical reasoning skills, on intervention skills, and just it really helps to elevate your practice in a way that no other therapist will get. So mentoring days are also very flexible, as Michael can attest to. His mentoring days change from rotation to rotation. So this example says it's on a Tuesday, doesn't necessarily have to be on a Tuesday. That can fluctuate week to week or rotation to rotation. Now, on the mentoring days, there's also a didactic component. So all of our residency faculty who are assigned to certain clinical rotations have developed this really robust curriculum where they're essentially giving a lecture on a specific topic. And of course, our residents are going because they have to, but it's also open up to the general staff. So it's really nice to kind of get people involved in, discussions and being able to learn or maybe review topics that they haven't seen in a while, and it's just a really great learning experience for everyone. And also all of our didactic curriculum is eligible for Con Ed credit, so if you complete all of the didactic you get a Con Ed certificate for each series. And then you can see there's a little orange box there that says Acute Care Journal Club. This is just an example. So when you're a resident outside of patient care, you are expected to have other responsibilities outside of maybe what a typical staff therapist would have. So this includes facilitating journal clubs, presenting case studies. You have a capstone project that is due by the end of your residency year. You're going to be involved in student council and helping to do clinical teaching and mentoring with other PT students who are rotating through. So there's a lot of other responsibilities that you have. And so we have to kind of, fit that into your schedule. Because you do have a target goal of 300 educational hours for the duration of the year. So that brings me to this little white box there on the bottom of Wednesday. So once you kind of get up and running, after your first, few months starting as a resident, you will also get dedicated time out of patient care to be able to dedicate to these projects because, as Michael can attest to, they tend to build up very quickly and you have a lot of things that you have to do. There's a lot of, homework, if you will, things that you have to keep track of. So we do give you some time off the floor to be able to focus on that and work on that, in addition to also having time to being able to study for your exams. Okay, so that's a week. Again, not every week looks the same, but we try to keep, at least within the clinical rotation, some kind of pattern that is really easy to follow. One other thing I will say about scheduling. So typically you'll work Monday through Friday, but this is acute care. So it's a 7-day operation. So starting in like January of your year, you'll start being in the weekend rotation, which means that you'll work one weekend every 6. And what's great about that is you have the opportunity to be able to float back and work on units that you were already oriented to and you've already completed training in to provide coverage on a weekend. And I think it's a really great confidence booster and also just, yeah, come in. And also just helps you kind of reinforce your clinical skills in patient care. So we are going to, let's see. All right, we're gonna, okay. So now that you kind of have a general overview of what a week looks like, of what a year looks like, how do you apply? Which hopefully everyone who's here on the call has either already applied or thought about applying or is going to apply today. Okay, so like I mentioned, our program is now enrolled in RFPTCAS through AbTree, which is the centralized application portal that most, I would say, candidate and accredited programs are operated by. This is the #1 criteria in order for us to progress to an interview stage, because our current job description is not available yet for you to apply as an employee of Stanford. We're working on it. HR is aware and we're hoping that it will get posted by February, maybe March. But if you have a completed RFPTCAS application in, we can go to the next step because essentially the career application is kind of more of a formality and that's how we keep track of your employment at Stanford. Some helpful resources for you. So we do have a PT residency website there, so it's hyperlinked. I can also send it to you guys if you guys want it separately. I can also email you, and then that is the email. That's the email for the residency program. So if you have anything, any other specific questions, and you want to email us later, you can do that at any time. And then be on the lookout for the jobs to be posted through LinkedIn. You can also check the external careers website through Stanford. Our acute care residency page also has a also has a LinkedIn page. So go ahead and give that a follow if you have a LinkedIn profile, because we'll be posting updates as things kind of progress. And then you also might see Workday actually, I think might be more internal, but I think once the job is actually posted on the Stanford Careers website, you also might be interacting with the Workday interface, which is a platform that we use for employment as well. Okay. All right. So that's how you apply. So when is everything due? Okay. So this is probably really important. So if you guys want to mark your calendars or save this for later, screenshot it, whatever, this is really important. So the RFP TCAS application cycle is already open now. It opened on October 1st, and the closing date is March 1st. That is a hard date. So after March 1st, we're no longer accepting applications to RFP TCAS. If you don't have a complete application in, you will not be considered for admission for the program. So if you have not started your application, or you started it, or you're thinking about it, what I would recommend is start asking people for letters of recommendation. I feel like that tends to be something that takes the longest, and you want to make sure you give your recommenders enough time to complete a good letter of recommendation for you. And they can submit it directly through RFP TCAS. So if you have somebody in mind, you need 2 people to submit letters of recommendation for you. I would probably ask them today or yesterday. The employment application, like I mentioned, hopefully it will be posted to the careers website by February. I'm in talks with HR right now, so as soon as I know, it'll probably be posted on LinkedIn, and then we'll make sure that it's being advertised there. And then the interviews really occur on a rolling basis. So for example, if you completed your application before March 1st and we kind of want to, continue with the process to see if you're maybe a good fit, you might get an offer for an interview before even March 1st, the March 1st deadline, because, we need to keep, this is a very time sensitive, endeavor. So might be incentive if you're thinking about completing an application. The earlier you get it done, the earlier you'll be in the queue of us kind of screening for an interview potentially down the line. Once we do the interviews, the formal interviews, we usually extend an offer within 2 weeks of the interviews. And then the target start date for the program is August 25th, 2025. So the formal offer and the contracts will have to be signed sometime in July. Okay. Okay, so here's some other, I think, really important benefits that I think are important for everyone. And I think also is something that people, keep in mind when they're considering to apply for a program like this. So these are some other really great benefits that we offer here at Stanford specifically and for this program. So we have a pretty competitive salary. As you all know, this is the Bay Area. It's very expensive to live in the Bay Area. And also typically when people are pursuing postgraduate residency programs, usually the programs are offering, a salary that is below what an entry-level therapist would get paid. So we understand and we're sensitive to the fact that there are considerable financial constraints and a lot of, that it's important. It's important. We want to make sure that you guys have really good work-life balance, but also, we understand that that's kind of the world that we're living in right now. Stanford also gives a really good continuing education benefit. So for full-time employees, once you pass your probationary period, you get $2,000 for the fiscal year to be used towards continuing education. So Stanford really takes pride in, professional development and continuing education. So it's just really great to have that as additional, funds to support whatever you want to pursue. We do not charge any fees or tuition. We're so grateful for that right now at this stage. Sometimes, I mean, if for those of you who have maybe applied to other residency programs, some of them come with a pretty hefty fee and tuition rate for the year. And we also understand that typically, since acute care residencies are very attractive for new grads, you're coming out with potentially a lot of student loan debt, or, you don't know if you want to defer your loans, or, everybody's circumstances are different, but we didn't want to create any more barriers for people wanting to come and trying to pursue a program like this. You do have the opportunity to attend CSM, which is typically the primary national conference for physical therapy. We do block it off in your schedule. If you're able to attend, we want you to attend. And then you can also attend other conferences or courses as schedule permits, as long as you are meeting the requirements for graduation and for accreditation. And then we also have a really great opportunity to get our residents in the OR to observe surgeries, which is really cool. I think not a lot of places offer that or even have that as an option. So again, just other really cool learning opportunities. And of course, this is just like a few things, I think, of many of like the really great benefits that we have here if you come to our program. Let me see if I missed anything. Okay, so that was all the information that I had. So now I kind of want to turn it over to everybody here. If you guys have any questions, or you can type it in the chat. And if you don't have anything specifically or you're not sure, we do have a list of questions that people have asked before that tend to come up a lot. So we can also talk about those as well. So I'm just gonna look in the chat to see if you guys have anything.
I had a question.
Yes.
Could you talk a little more about the elective option for the kind of last rotation? Like what are the options for the elective? Is it like a select list, or is it something that like we can choose, like say we're interested in like wound care or like lymphedema or something like that? Like, is that a possibility, or is there a set list that we have to choose from?
Yeah, that's a really good question. I would say so we're in our first year right now, so we're kind of like still figuring things out. And the short answer is we don't really know, because Michael hasn't done it yet, so we don't really know what it's going to look like. But the way that we're kind of anticipating it's going to look like, so we kind of are designing it as like a choose your own adventure. So let's say you have completed all of the trimesters, you passed all of your exams, all of your clinical mentors say that you are like proficient and you're an advanced clinician in the respective rotation, and you don't have any like remediation that needs to happen. Then, towards like the end of your final like formal rotation, we can have a conversation around like, okay, what are your interests? What do you think? Do you think you want to spend more time going back to a service? Do you want to spend more time in an ICU? Do you want to spend time in inpatient psych, chronic pain? Do you want to do more lymphedema? PTs here don't really do wound care, but we do have PTs who do like wound care treatment. I'm sorry, lymphedema treatments. We have certified lymphedema therapists here. Maybe you have more of a vestibular interest. We have really amazing therapists here who are vestibular certified and experts in, that. So maybe you want to spend more time in the ED and work it. So it really kind of is like really flexible. I think a lot of it is going to depend on your interest. Kind of what your mentors think would be a good opportunity for you, and then also kind of what we think is feasible in the time. Is that helpful?
Yeah, that is. Thank you so much.
Okay, you're welcome. Yeah.
Could I ask another question?
Yes. Ask as many as you want. And then I see Amanda's typing, but yeah, please type. You can type in the chat too.
It was Michael, right? Is the current resident?
Yes. Yes.
Could you actually kind of talk about your experience of the program so far? Just kind of like a high level, kind of broad umbrella statement of like what you think about it, and also like kind of like the challenges that you have encountered like being in the residency.
Yeah. To be honest, my experience so far from the residency program has been great. I think all the mentors you get assigned to are filled with knowledge, and everyone just wants to, see you succeed, so they share their knowledge with you. You know, for example, like I just started my neuro rotation, and when I was a student, I did not work with that population. So I'm now in my first week, and I'm trying to like recall all like these different facilitation techniques or things from school, and I'm trying to apply them. And just having my mentor there, like giving me feedback in the moment, and then even showing me like new skills that like I didn't think of is so helpful. Because imagine if you weren't in the residency program and you just started, like you kind of just get thrown in a little bit. You get some training, but not as much training as like this one-on-one mentorship you get. So I really enjoy that. That's what really makes this program like worth it for me. To answer the second part of your question, the challenges, I think Lauren like said it earlier. You are responsible for a lot of different projects and just a lot of different activities. For example, I think this Friday I'm teaching like a student mobility lab. Um, so you just got to keep in mind like how am I going to organize my day? Um, while keeping in mind these other projects, while still keeping track of your patient care time. That could be challenging, but as long as you go in with the plan, I try to plan my weeks like ahead by 1 to 2 weeks, and I look at my calendar and I say, okay, what's going on this week? Okay, I'm going to dedicate Tuesday to work on my journal club presentation that I have coming up. Um, So that part could be challenging, but honestly, it makes it really worth it because it challenges you, right? It challenges you to, um, just stay organized and research and bring that knowledge that you found back and share it with your peers and get feedback from your peers. So it's been a great experience, to be honest. Additionally, if you look back to the slide where it says all the benefits, like the pay, not having to pay tuition, that really tipped the scale for me too when I was applying to the program. Let's want to throw that out there.
Mhm. And something also that is new this year. So we are actually here. So I know I'm really loud, but um, so our program is not officially accredited yet. We actually have our site visit happening in March. And then hopefully we will be fully accredited by Aptree to say that we are like meeting the standards of a residency program and meeting, the expectations that we are training people in a specialty area of practice. Um, and as part of their requirement, something that we have to post online, and this is actually available on our website right now. It's a financial document that actually shows like the financial package that we offer. And it's essentially a spreadsheet that you can plug in your own financial situation and say like, okay, I think this would be a really good financial investment for me or not. And it's just very concrete. It's all the numbers. So, and every program is required by accreditation to have that posted to their website in order for you to compare if you think that that's a good investment for you. So that's a really good tool. And it is on our website now if you guys want to see that anytime.
Thank you.
Yeah. One other thing I will also throw in really quickly in terms of like money as well. So Stanford is also an employer that qualifies for public service loan forgiveness. I think that's also another thing that helps tip the scale for people if they want to do a residency. So your year working here as a resident, and if you decide that you stay on, if we think that that's like a, what is the next step for you after residency, and then if you work for 10 years, your loans will be forgiven if you sign up for the public service loan forgiveness program. So it's another. Do you have anything?
Hi, I have a quick question about
Yeah.
the PTLA like requirement. So I would take my boards tentatively in July, and that's the
Mm-hmm.
28th, 29th, and then I get my
Mm-hmm.
scores on the 5th.
Mm-hmm.
I feel like it's really cutting it close in terms of like the decision if like if I'm eligible or not. So I was just wondering,
Mhm.
how does the PTLA work in that sense? Because I would have to be under a supervised therapist at Stanford. Is that correct?
Yeah, we'd have to look at it to see how it would work because yeah, then you would have to have cosign and it's also like contingent on you getting
I
licensed.
think we
What
all
do you
have
think?
had to go through that.
Yeah.
I remember when we applied to ours, like I was still, well, I took my boards early actually.
Uh-huh.
But like most people are in your situation. Most people don't get to take boards until July.
Yeah.
And so it's like kind of contingent on if you pass boards. And then
Mhm.
once you pass boards, everything is actually pretty smooth sailing in terms of
Mhm.
paperwork. But just know you're probably in the same boat as 95% of people
Yeah.
in those schools.
We'll have to look and see if like the PTLA status would also be feasible. That's something that I would have to go back and talk to leadership about more specifically, like just in case. But yeah, I took my boards in July also, and then I started a residency like September 1st. So it is very common that I mean you guys are really smart, like you'll pass. So we're not worried about it. But let me get back to you on that, Josh. Let me ask more questions.
Thank
I'll
you.
get back to you.
A follow-up question from
Yeah.
Josh. I'm planning to take the April boards,
Uh-huh.
but I guess like I'm applying, like I'm from out of state, and like so my state kind of designation for my board exam is kind of up in the air, and I would need like 30 days ahead of time to switch my board exam date. So like
Uh-huh.
I know the timing for the application due date to the interview is like a month. So I guess w- in your kind of opinion is like, is there enough time for me to like be able to like switch around my like state jurisprudence kind of
Yeah.
designation of where I'm taking the board exam before? Yeah,
I
we
think you'll
know.
have enough time.
Okay, for sure.
I took mine in Texas. So
Okay.
and I had originally applied for Texas, and so um I had enough time to do it. And it's just a matter of like going through the whole process. It can be like
Mhm,
a little bit tedious because you have to send in like fingerprints, etc. But
Mhm.
mhm.
everything's pretty laid out for you, and I was able to do it within the time frame. Um, so I understand, but I think overall it was pretty easy transition for me. I was able to do it in a few months.
Okay, so would I like how about transfers? Like if I say I pass my board exams for a different state, transferring over, as long as I pass the NPTE, like that's just smooth sailing from there with
Yeah,
whatever.
correct.
Okay,
From my
sounds good.
knowledge, yeah.
Thank you.
And as long as you can prove that you're licensed in the state of California by the time you start the program. So it's not by
Okay.
the time your application is done. Like we can interview you and we can send out a contingent offer and say, "Hey, we can accept you in the program, but X, Y, and
Mhm.
Z has to happen, and that includes the California licensure." Yeah.
Okay, cool. Thank you so much.
Oh, and also we forgot to totally mention this. So Michael's our resident right now, but we're actually wanting to take 2 residents for the upcoming cycle. So that's essentially doubling our cohort. So more opportunity, less competition.
I think it would also be nice because Lauren and I were co-residents. It was the first year in our program that we did co-residents. And what we really enjoyed about it was the fact that we can lean on each other
Mhm.
and we both knew what we were going through. It's a very unique experience, but it's a very rewarding experience. And I
Mhm.
think having someone going through the trenches with you is really helpful. As well as having access to all that mentorship and help with projects and whatnot. Michael, you're a trooper. But yeah, I think that is the benefit of having 2 residents. I know some programs only have one, some have multiple. So I would look into that too as you're looking through programs and what really kind of serves you, and what works best for your learning styles.
Hi, I had a quick question
Hi.
regarding sorry, my camera, I don't know how to turn it on.
That's
Um,
okay.
I would turn it on though. But for mentoring, is it similar to how it is when you're a student and you're doing a rotation, or is it structured a little differently?
You want to talk, Michael, about this?
Yeah, that's a good question. So I would say your mentoring session, it's kind of what you make it. So I start the morning with my mentors and we lay out goals. And the goals could be from ranging from, I want to try this technique with this patient today, or even like towards the end of my cardiac rotation or towards the beginning in the beginning of my cardiac rotation. A lot of it was just trying to understand the chart a little bit better and taking the time to understand like, okay, if this is happening, what could this potentially lead to? What is the team thinking? Like that deeper understanding. So for the mentoring session, it's kind of up to you how you want it. It is kind of like I would say, like when you are a student, but again, if you want to focus on like chart reviewing, if you want to focus on trying new techniques, it's kind of up to you and how you make it. So it's a really good time. And, towards the end of your rotation, when you're at a full caseload, like Lauren was saying, those mentoring days are protected. So even though like you're expected to see, I don't know, let's say 8 patients, by the end of towards the end of your rotation, on those mentor days, like you're scheduled to only see 4 patients and those 4 patients only. So you have the time to like really deep chart review, really research, okay, what can I do with this patient to make this session like very beneficial? And then the good thing about that is you do it once and you take what you learned moving forward.
The other thing I will say too, Amanda, I think this is you who was asking the question, but I think, it's important to remember that while you are like a learner in this program, you are a licensed practitioner. So the whole point of the mentoring is for elevation, which essentially is what should happen when you're a student as well. But the goals, I think, are a little bit different. And so it is supposed to be that the mentoring is designed to be different than when you're a student. Um, Also, there's other nuances. For example, when you're a student, you always have to have someone co-sign your notes. That's not the case when you're a resident because you are the provider. Things like that. Of course, you always have someone who you can go to and ask questions, but yeah, it's meant to really help you advance your clinical practice and like in an expedited way more than, a student or another staff therapist.
Thank you. Yeah, that answers my question.
Okay.
I also had another question. I don't, because it wasn't something that I necessarily had to deal with as a student, but do we have to worry about like productivity rates or anything like that? Or is it more just getting our like patient, I guess, hours in total?
I would say, based off of my experience, and Michael, you can chime in too, based off of your experience here, is that the idea is you're going to ramp up on every service line. So you're kind of starting new a little bit on every service line. So you might start to see maybe like 3 to 4 patients, and you will ramp up to a full caseload, and it's expected for you to see a full caseload by the end of that specific rotation for every service line. The idea behind being an acute care resident is by the end of this, you'll be a generalist. You'll be a general therapist. You can go to any service line. You may not be like a super big expert in a particular patient population, but you should feel comfortable when you're on those units to be able to treat, do the necessary things, and make great recommendations and carry your own load. And the idea behind it is you are a licensed therapist at the end of the day, instead of like a student who's like ramping up to the end and maybe you're carrying like a 75% caseload or whatever it is to be entry level. You are expected to hit that full caseload. And you will with help.
Sounds
Yeah.
good.
I agree.
Just
Yeah.
wanted to clarify.
What are the productivity standards for?
Great question. Yeah, so for an 8-hour day, you're expected to see 7 patients, could be evals or treats, and bill, I think it's 21 units.
Yeah.
Something like that. 21 units of service. I think Rihanna's on the call, but she might be driving. And then if you work a 10-hour day, we are expected to see 8 patients and I think bill like 25 units or something like that. But when we were pitching the idea of getting this program off the ground, as you can imagine, that it takes like a lot of manpower, and like it really is like a team project in order to get something like this off the ground. And they like, you know, leadership and faculty, everyone knows that like not every day you're going to be super productive just by the nature of how the program is designed. However, when you are, you know, maybe you don't have a mentoring day and you're working on a Saturday because you're in the weekend rotation, or, you know, maybe like, you know, you're on a day where you really are just in patient care for that full day and you're like, wow, I actually don't have a class or a project that I need to be involved in. The expectation is that you're able to manage a caseload like any other full-time therapist would, right? And for those of you who have had, you know, rotations in acute care, you know that like it's constantly ebbs and flows, right? So really think of it as more of like an average week over week versus like every day. If you're like, oh, I didn't see 7 people, like, you know, if we there are always so many variables, and even more so as a resident. So it's definitely not something that I would say you should judge your success by entirely. I think there's like so many other things that factor into that.
I think another thing I would go off of that is one of the benefits that I didn't realize I would find in a residency, but ended up really thriving after on, is like triaging, learning how to triage a list. And I think that also goes into the talk of productivity. On different service lines, you'll notice that you start with a different number of patients, and that's just the culture of each service line. But through your mentorship, through your resources, the teams around you, everyone will kind of teach you, okay, how do I triage this list? Who's the most important to see? Can I pick up? Should I not? And you learn those soft skills that I feel like, I guess I wouldn't know because I went straight into residency, but as if I just started out as a new grad in an acute care hospital at this level, I don't know if I would have fully comprehended the art of it. And the importance of it, and managing a whole unit, and being able to speak and advocate for our profession as well to other teams. So I think those soft skills like triaging, and then kind of understanding what productivity kind of means, I think those are things you'll learn through an acute care residency that maybe you wouldn't get just solely as a new grad.
Follow-up question with that. Sorry, I have a lot of questions.
No, this is why we're here.
What's like Stanford's culture or the PT department's culture on like co-treats with OT? Like, is that something that is kind of like encouraged, dependent on patient population and situations, or are we like, yeah.
We'll take this one.
I guess so. It's different on every service line, but the overarching theme, I think, is if it's skilled, right? So if it's a skilled need, maybe you're potentially progressing and you really feel like you need two sets of skilled hands. So yeah. So like, I think just thinking about it from that lens, what's really great, again, about Stanford in particular, and being at a couple of other academic hospitals, is that we have a ton of resources here, and one of those is a robust number of rehab aids for specific towers and service lines, and they are a wealth of knowledge, and it's incredibly helpful to separate those sessions, to maximize that time with therapy, and to spread out our sessions too, so we can see more patients on those units. So I would say on every service line, we really work well together on teams. At least when I float to different service lines, everyone's pretty much like, okay, you'll see this patient today. Okay, I'll see them tomorrow. And making sure that we're all doing it in a safe way as well, because we understand that we see a very high complexity here. And what comes with that is maybe a little bit more heavy patients, or dense, or whatnot. So we want to keep in mind safety, but also, is it a skill need? And I think as you go through the service lines, you'll realize that that's the overarching theme, even though each team has their own way of doing that.
Well, thank you.
Michael has to leave in a few minutes, but I am also available to stay a little longer if you guys have questions, but I just want to give everybody an opportunity if you wanted to ask Michael anything else specifically while he's here about his valuable insight, experience, anything.
Yeah, I have a question for Michael. How did you choose or your capstone project, and what is it like?
Ooh, Josh, great question.
Thanks.
And that's just for the microphone because they can see over there. But yeah.
So Lauren does a great job. You get kind of almost weekly check-ins with Lauren, and Lauren kind of helps keep you organized. Hey, you know, your capstone project proposals coming up. Let's start thinking about it. So I was on the cardiopulmonary unit, and what inspired me to pick my capstone project would to just focus on diaphragmatic strengthening was I had a patient who just had a very impaired diaphragm. He was a heart transplant, complicated by amyloidosis, and he just became very deconditioned. And one thing that we noticed with him is he was struggling to stand, and he just was not using his diaphragm at all. Even in sitting, it was just difficult for him to stay stacked. So through a mentor session, I looked up what can we do with this patient, and through that research that I did with my on my own during that mentor session, I kind of used that as the foundation to write up my capstone proposal, which I'm still finishing up right now. Um, but yeah, I think the weekly mentor sessions, because you have to fill out a form every week, and you kind of talk about like what did you do? What did you learn? What outcome measures could have been done? Like you have to write down like all the impairments, you know, things that went well, things that didn't go well, things you might work on in the future. Um, those weekly mentor sessions, you get to keep all your answers, and you could go back and kind of like use that as the foundation to picking your capstone. That's what worked for me. Because I know it is difficult because you don't get to see all the units before having to pick a capstone project. Um, but you'll find that there are needs as you get comfortable working here, and then yeah, you just always ask questions. I mean, that's kind of how I picked mine.
Yeah, and something else too, Josh, to keep in mind is that, you know, we know that like the capstone, there's a specific deadline for that. And so the project has to be feasible in the time that you're a resident. And, you know, Stanford, there's always something going on. There's like a million projects happening, you know, there's different committees working on different things. And it's also possible that maybe there's a team that is already kind of working on a project, and maybe it's something that you're interested in where you can be more of a leader in that project and be able to have, you know, a project come out of that. So that's also an option as well. It doesn't have to be like totally novel, but it does have to be something that is feasible, that you can measure, and also something that you are going to be crafting a presentation to be presented, one, to the department as part of graduation, and two, to be submitted for a conference for you to be presenting in a larger scale. So that's kind of the goal for that. So there's, you know, options. It's not just like, oh my gosh, I have to come up with something totally new. Like, you know, there's a lot of flexibility there. Burning question. We also have another PT student here who's here listening. She just started her rotation here at Stanford like yesterday or 2 days ago, last week. So she's here, you know, also soaking it in. But any other burning questions? Anything else at all?
Um,
Yeah.
so what is I guess like if you could share some statistics on applicants for like last kind of cohort, if that's allowed.
Yeah, so I am collecting data on like everything. I don't have like a lot of hard numbers, but I guess what I could say is last year, I think we had maybe like 5 people apply for one spot. Is this what you want to know, Andy?
Oh yeah, yeah.
Okay. 5 people apply for one spot, but not all of them had a complete application. So, and we will only move forward if your application is considered complete. So, and like we send reminders, you know, hey, you still interested? And if we don't hear back from you at a certain time, then like we have to move on, right? This year, now that we have RFP TCAS, we have more applicants now, but what I will say is not all of them are complete. I would say they are pending. These are people who are interested. And just because people have applied or clicked apply and started a profile does not mean that they will complete the application. So, I think this is because one, RFPTCAS is more like broader marketing because we're able to like cover on a national scale a little bit better because that is what all programs use across the board. So I think that's in our favor. But the application requirements this year, the stakes are a little bit higher. Like it's a little bit more of a comprehensive application. And, you know, I think last year we only had the job application. That was the only step because we could not enroll in RFPTCAS. So, yeah. So we'll see. Stay tuned for that.
Thank you.
But like I said, we want to accept 2, hopefully. So
Okay.
that's a really great opportunity.
Side question, you guys use Epic for your EMR or?
Yes.
Okay, okay. I just started using Epic and it makes a world of a difference.
Yes.
Yeah.
Yes. Yes, we do use Epic. That's good to know. Yeah, Michael has to go. I'll stay on for a few more minutes. Also, if you have to go, you can go too, or anybody. But do you guys have any other? Thanks, Michael. Bye, Michael. Any other questions? Let me see if I can maybe also see some other things that people typically ask us real quick.
I do have a question again.
Okay.
What are your kind of
Yeah.
like expectations in terms of like for the candidates in terms of, I guess, their extracurricular, since they're coming straight from PT school, or a lot of applicants are coming straight from PT school. What is the expectations in terms of like experience, like clinical experience? Like I guess I'm trying to understand if like there's like something more like extracurricular that like kind of sets the person, the student apart, or that it's
Yeah.
yeah.
That's a really good question because some people tend to also ask us, is it a requirement to have acute care experience to go into a program like this? And the answer is no. Obviously, your learning curve may be a little bit, I guess, less intense if you at least had some type of clinical or rotation or some type of experience in acute care. I think that exposure can really help just kind of lay the foundation. But essentially, what we're looking for are people who are, you know, it's kind of going beyond just being like, I'm passionate about acute care, I want to be here. It's kind of like, how can I take my practice to the next level? Like, how can I really enhance my learning and know that by the end of 1 year, it will be as if I had 5 years of experience crammed into one, right? So we're really looking for people who have qualities to be able to handle the rigor of a program like this, to be really flexible, to be hyper organized, like what Michael was saying earlier. Like you guys are juggling a ton of things and you have to like, you're constantly weighing like many different responsibilities and hats all the time. You have to be a very active learner and take ownership of this learning experience because you really do get out of it what you put into it. And we just, you know, and we also want people who are really, you know, adept and willing to be able to take constructive criticism and feedback constantly, right? Like you're kind of under a microscope, almost like a student, but it's because we're really trying to push you and help you advance and be better. So I wouldn't necessarily say that there's any other like extracurricular things specifically that would maybe set you apart as an applicant. Because a lot of what you learn is experiential through the program here, but it's how you can show that you can really represent Stanford well as like a resident, someone who's going through this very special program. And at the end of it, you'll be seen as like a leader, within the department and within like acute care. Like there's that potential for like a really important growth trajectory. Does that make sense, Andy? I don't know if
Yeah, it
and
does.
Christina might have something else to add.
I think for personal experience, I came in with only an acute care rotation in pediatrics in the pediatric ICU. So applying to this or an acute care residency, knowing it was solely adults, it was quite the jump for me. I think going through the program, what I think would make the most successful candidate or resident is someone who is willing to take initiative over their own learning and someone who is willing to ask the questions and not just wait for the feedback to come to them. Someone who wants to grow this profession in acute care specifically. I mean, physical therapy is growing quite a bit in like multiple different service lines. And like Lauren mentioned, specifically, I would attest to cancer. The most, we have an entire cancer center. So someone who wants to be a leader in that respect and is willing to learn, adapt, be a sponge, but also initiate things and just take control over their own learning experience. I think you need both to be a successful resident. I think you need both to maximize this experience, no matter what program you choose.
Thanks. Thank you.
Okay, I'll take just like a few more minutes because I really appreciate everybody taking time out of their evening to join us on this webinar. We like really, really appreciate it. And sorry for the technical issues earlier. We answered a lot of them, yeah.
How big is the therapy team?
I feel like it's growing, so I'm not sure.
Yeah, I feel like the last time I asked about how many PTs or PTAs there were, I want to say they said like 80. That's just
80?
PT. Yeah, I want to say maybe the
Oh,
staff total is like 150 or something, and that's PT, OT, SLP,
okay.
and managers. Yeah, it's huge. I mean, it's a massive team.
So it's like you guys have multiple PTs covering the floors, right? Okay.
Yes. Yes, exactly. Yeah, PTs and OTs.
I don't have any more questions. Thank you for answering all of mine. I really appreciate um, the talk today. It was really insightful and helpful.
Absolutely. Yeah. And also, if you guys have any questions about what I covered in the slides or need me to clarify anything too. But you guys also have the email. I'll just put up this last slide here. This is the email address for the program. So if anything comes up between now and, when the application is due, or anytime really, you can just send an email. I manage the email account, full disclosure there. So I can always, answer any other questions that you guys have. Or I will also be at CSM this year in Houston. So if any of you guys are going, I will be at the Stanford booth, IRL. So you can come and ask any questions. We can chat, whatever. So we really appreciate you guys coming on, your Wednesday evening. I know it's like maybe you're at work or at school, or we really, really appreciate it. So a copy of this video will be uploaded to our website, so you can always go back and reference it at a later time. So thanks, everybody.
Thank you, Lauren.
Thanks. Nice to see
Thank
you.
you.
Nice to see you too. Bye.
All right, everybody, take care.
Any questions? No, I was like,